and I would like to tell you a little bit about my company, Neural Dynamics Technologies, or NDT in short. I know it's a long name, where we're working on creating high precision closed loop neural interfaces. So I'm an academic who's trying to start a company, or trying to run a company, so bear with me here. But I myself am a neuroscientist by background, spent a long time in academia doing basic research, and met my co-founder, Jörg Scholven, who's an electrical engineer, while we were working at MIT in the lab of Ed Boyden, who is a neurotechnologies engineer by background. And we worked together in a lab on creating this technology, and at some point we decided we should start a company around it. By now we've got a small team, and so we have a dedicated microfabrication engineer, Girish Ugabudur, and we have a computational neuroscientist who's working on modeling various aspects of our technology and data analysis. So originally came out of Ed Boyden's lab at MIT, and since we worked actually in the lab, we've been working closely with two clinical collaborators, Alexander Rothenberg from Boston Children's Hospital, Harvard Medical School, who's a professor of neurology, treats many patients with epilepsy, and who also runs the neuromodulation platform there. And another collaborator is Stanley Anderson. He's a professor of functional neurosurgery who treats a lot of patients with epilepsy and Parkinson's. And both of these clinicians have been advising us along the way about, potential clinical, prospects of our technology. So we're trying to, put people together from different parts of the world to try and make something useful. So what we do is we create electrodes that are very much like the traditional Michigan type of recording electrodes, or NeuroPixels, if anybody's familiar with those. So basically we use nanotechnology fabrication to create high precision record only and closed loop electrodes. So we create these electrodes that look like this. It's basically a lead with many, up to 1,024 individual electrodes. And we use nanotechnology to create the wires that wire all of these up to get, as many as possible electrodes on there. So we started out making record-only electrodes, but our main focus, rather than just getting the highest channel count electrodes, is to really provide customization. Every part in the brain is different. Every part in the brain requires a different solution. So we use massless e-beam lithography to create basically any design you want in terms of your electrodes. So electron beam lithography is a type of lithography where you can just essentially create an arbitrary structure. And so we use that to create whole wafers full of different types of electrodes. So every neuroscientist wants their own electrodes, and so we're able to kind of provide that customization. Another thing that e-beam lithography allows you to do is to create features with or wires with very small feature sizes. So the wires we create are on the order of 100 and 200 nanometers. And we can create our electrodes really close together with like 1 or 2 microns apart, so that we can really oversample the neural space. So one of the first things we did when we started out as a research tool company is to provide an online platform where users are able to create their electrodes according to their specific design requirements, and then test them out in a 3D virtual brain. So you can pick and choose whatever part of the brain you're interested in and create your electrode, really zoom in down to the individual electrodes and see if you like what you see. And so we've designed a couple of different types of electrodes. Here's just some sample data to show you what we can get with these type of electrodes. So this is data from a cortical column, basically, where you can get a lot of high resolution local field potentials and single units simultaneously. So with these electrodes, you can both record single neurons and the local fields. We've created custom electrodes for cerebellum, for example, where it's a very simple structure and there are only 5 cell types there, and we're trying to use our electrodes there to record from every single cell type simultaneously in a specific region. Everybody wants to go towards chronic application, of course, also in the research field. So we've also made our probes compatible with chronic applications. In this case, we created electrodes to be used with the E-Cube amplifiers, which are little amplifier systems that can be carried on the head of animals so that you can study the brain in a freely moving environment. And we've shown that at least for up to 2 months so far, we can get very stable recordings, even though our electrodes are not very flexible. So now, as part of a phase 2 award, we're working on custom ASIC designs for our electrodes so that we can actually provide chronically implantable solutions. But we're keeping the fabrication of those things separate so we can keep on providing the customizability aspects. And we're also now working on integrating the stimulation requirements. So we want to create solutions where we can both record on high density electrodes and also then pick and choose where to stimulate from, so that as a researcher or clinician, you can pick and choose which electrical fields you want to create. And so these prototypes are now being tested for the first time in animal models. So we're working with Suhan at Boston University, where we're testing our electrodes in mouse models of Parkinson's disease to see if we can approach something like deep brain stimulation results. We're working with Alexander Rothenberg at Boston Children's Hospital in rat models of epilepsy. And we've also created non-human primate electrodes now that are going to be tested at Columbia University in both healthy animals and translational models as well. So ultimately, while we're mainly a research tool company at the moment, once we have implemented the closed loop capabilities, we do hope to potentially work towards a closed loop high precision deep brain stimulation platform, where of course we can provide the high precision, the closed loop aspects, minimal invasiveness, because the electrodes will be a lot smaller than existing DBS electrodes. And ultimately also, of course, some wireless capabilities. We're estimating and hoping that the power requirements of our type of electrodes will be a lot smaller than existing DBS electrodes. So with that would also come, the development of a new powering platform. So in terms of our business models, we're really just a research tool company at the moment. We sell directly to academics, clinical industry researchers, but we are keeping the door open to actually becoming a full-fledged medical device company at some point, and we're also open to any form of partnerships. So this has been our progress so far. We started in 2018 with the generous support of the NIH, phase 1 SBIR grant that allowed us to take the technology out of the lab, which is now being followed up by a phase 2 award. And in the meantime, we started selling some probes, and we've been part of other people's grants. And more recently, we were accepted into the Y Combinator program based here in Silicon Valley. And since then, we've been trying to raise a pre-seed round. So even less money than people mentioned before. We're only raising $1.5 million. And this round is not closed yet. So anybody who has any suggestions on how we can get there, I would greatly appreciate it. So a quick shout out to the Brain Initiative, who's been very, allowed us to get started as a company. And I have to say that every communication with the NIH has been extremely useful and productive. And just a couple of our most recent investors. So thank you.
All right, thanks very much. We'll open it up. Questions in a minute. Before Jojo, I have one question first. I'll make it really quick though. Tell us about the Y Combinator experience. I know a lot of people have tried, and not everyone is chosen. So first of all, congratulations. Second,
thank you.
What was it like?
Yeah, well, as you know, Y Combinator is more focused on software tech, right? So I think they're trying to branch out into healthcare space. We were part of I was part of a group of 10 medtech companies, and which was very exciting. But I have to say, we were not as successful as the software companies in terms of raising money. I think it's more of attracting the right type of investors.
Right. My understanding is they put up a little bit of money, but really what they're hoping to do is to get you to magnify that.
That's right.
Right.
Yeah.
Jojo, you have a question.
Thanks for sharing the mic, Jim. Get it.
Not too much, sir.
So just in terms of your 1.5 million, what benchmarks do you hope to achieve through that funding?
Yeah, basically the point we want to get to is first in human recordings, which we're hoping to do with our existing collaborators.
Okay, Victor, you have a question.
It's more about marketing strategy. Of course, we had my NeuroNexus and other companies in the research market, but this is you're targeting human market, and I presume an intraoperative recording, right? First, or short-term recordings first. So what would be your differentiation from NeuroNexus and other companies who are more like research oriented?
Well, really, at the moment, we're open to selling to researchers mostly, right? So we're also just a NeuroNexus. But I think the customization is really where I think we come in. For us, it's really cheap and easy to do customization. NeuroNexus can do it, for example, as well, but it's fairly expensive upfront. And so, and ultimately, in terms of the clinical marketing, it's really the closed loop aspect. I think that's going to make the differentiation.
Okay. Jeremy, do we have any questions from any of our friends in the Zoomosphere? We do. We have one question, and who is it? Loudon?
Emily Caporeo, can you discuss any plans to different?
But why don't you let Emily ask the question? Emily, go ahead and unmute your mic because we all want to hear from you.
Sure. Hi, everyone. This is Emily at NINDS. I'm just curious, you mentioned in the beginning, you talk about your clinical advisors, and I'm just curious what you guys are thinking, I guess to follow up on Victor's question, what you guys are thinking about in terms of a clinical path in the future.
Yeah, so we really hope, first of all, we want to develop these closed loop electrodes so that they can actually do what they can, what we hope they can do without any of the issues that come with it, like the stimulation artifacts. But really the goal is to get them into humans, to get them into the thalamus for epilepsy, to see if they can be a better closed loop DBS alternative. I think one of the issues with DBS is a lot of side effects that come from stimulating too much in the brain, more than you're hoping to. So we're hoping that by making smaller, more precisely targeting electrodes, we can alleviate a lot of those side effects.
Great,
Okay.
thank you.
Any other questions? If not, then Ingrid, thank you very much. Great talk.